One of the hyperplastic breast changes, the most frequently occurring and the most troublesome, is both for the patients and for us physicians, the fibrocystic change. I hope I convinced you. How can you ever learn breast imaging without three-dimensional histology? You understand that this patient has breast pain, fluid-filled cystic cavities, distended ducts. Here is the explanation. You cannot compress fluid, or if you want to, it passes the energy to the surrounding full of nerves. How come that breast cysts are formed? How come that middle-aged women do not have steadily dripping nipples? The ducts are not only pleated, but there is a twist on them. Mother Nature is very smart. Why the twist? Because when she is 40, 45, the elastic tissue is already decreasing in the body. That's why we got wrinkles. And so when the apocrine metaplasia produces a lot of fluid and it quickly rushes out to the duct, then it just closes up. Otherwise, women would have big trouble with the steadily dripping nipples. So when your patients are complaining that they don't like that they have recurring cysts, comfort them. Be happy that you have a cyst, because otherwise you would have dripping nipples. And the ultrasound guided biopsy is really a godsend, because when they feel it and they are convinced that it's cancer, you can immediately cure it. Old cysts have these floating particles, epithelial cells, proteinaceous material. Doesn't matter. You can just clean up the place with one little stick right in front of them, and you are going to be a good doctor. So, how come that the 22-year-old woman's TDLUs are producing the milk and they run out to the duct and they hit the hole and the baby is happy? Same woman 20 years later, TDLU produces fluid, we don't call it milk, the duct is there, the hole is there. How come that they don't have dripping nipples? The young woman's periductal tissue is elastic tissue, rubber band. When the oxytocin comes from the pituitary gland, then the rubber band contracts and shoots out the milk. The thing is, 20 years later, no rubber band. Goodbye. Gone. So when the fluid comes, then the duct is slack and twisted, and it collects the fluid in a pool. Mother Nature is unbelievably smart. Apocrine metaplasia. Change means metaplasia. And these are the pink cells that produce the fluid, but we are not talking about now very large amount, just a drop here and there. Sure, the acini become distended, the fluid is turbid, cloudy, and fluid is going to be collected within the smaller cysts and the larger cysts. The closer to the nipple the duct closes up, the larger is the cyst. Comfort your patients. The larger number of openings, the more ugly fluid, the more benign type. Straw-colored clear and blood, that's pathology. And they are formed around menopause, simple epithelial cells, and apocrine metaplastic cells. Apocrine metaplastic cells are naughty. Enjoy this. This is fantastic. Understand that if you have these in your mind, you are going to be able to explain the patients what's here. And of course, this is a very viscous fluid, because if it stagnates, the water is going to disappear from here. And it's surprising that the neighbor doesn't care. That's normal. This is cystically dilated. And that's very thick fluid. And within that, calcifications may occur. And if they are occurring in the duct, then we talk about plasma cell mastitis type calcification. If it occurs within these small cystic cavities, it can be skipping stone, but then it's multiple cluster. It may be powdery and may be crushed stone-like. That's our problem. You see, cysts, sclerosing adenoses, a lot of cysts, just a beauty. Every second woman has this. Fresh cyst doesn't have the cloudy content. Now let's go over the calcifications. You see here are the crystals. There are three types of calcifications. One of them is the Samomobody-like calcifications. Those are the oyster pearl-like, skipping stone-likes in clusters, not like in the DAB. And the weatherlights, actually that's the only thing I'm pulling this for you. Samomobody-like may be easy for you, may be hopeless for you. Namely, if they are sedimenting on the dependent portion, then they are easy. We think it's one piece of stone. It's not. It's many, many, many tiny. This is when it's a problem for us because we cannot distinguish between grade 1 cancer in situ and sclerosing adenosis. Apocrine metaplasia, oyster pearl-like calcifications, many and teacup. And of course, the teacup-like calcifications can be seen provided that you teach your technologies that give me a 90-degree image, because otherwise you are not going to be able to see the clear T-source teacup-like calcification. It's one piece on 3D too, and of course, one piece on the mammogram too. So, I see this. I'm not going to call her back. I know the pathophysiology. And looking at from above, then you see this breakfast plate seen from above. And it's so many, 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 many. High density, seen from the side. Low density, seen from above. Fibrocystic change. 48. Orthogonal projections, 90 degrees on each other, fading away in the surrounding. Weatherlights, calcium oxalate. You know, as long as we had the film screen mammogram, then we had these chunks, silver, bromide. We couldn't see these stones. Now you have digital mammography, so you have the pixels, and pixels love anything that has a sharp corner. As soon as full-field digital mammography was introduced, suddenly we found many more calcifications. Now, many of these slides are from my friend, and this gentleman is James Weddell. Englishman who sailed the seas and described a sea that wasn't on the map. So it's called the Weddell Sea. If you have Google Earth, then you just write in Weddell Sea and you are down in Antarctica. He was born 87, died 39. What I'm saying is that 100 years later, 1935, divers went down to the bottom of the Weddell Sea and they found these beautiful crystals. And so they called it Weddell stones, weatherlights. Analyzed, look like diamond, double pyramids, octahedron, poison. 1985, French researchers found calcium oxalate in breast cysts. And Chris just published this in 1993. I've known about this for a long time, but I'd never talked about it because it was not visible on the film screen mammogram. But now it's fulfilled digital mammography. Do you see this beautiful crystal? So we made 3D image of this. I switched off the penetrating light. I took a halogenic light. So the background is dark, but the light hits the diamond and it shines. Dear colleagues, this is the weather light. Spearhead, double pyramid, or as soon as you go home, open your safe, take your diamond out, looks exactly the same. But watch out, this is a poison. On the bottom of the lake and in the breast of women. 1 or 2 cases. A few weeks ago, we had a de novo group of calcifications. Are these within ducts? No, sir. I think it's a cluster. If it's a cluster, the immediate question is, are these discernible? Yes. So it's not powdery. No, it's not powdery. If it is discernible, is this fibrocystic change? Is it fibroadenoma? Is it papilloma? I would not think about fibroadenoma and papilloma for the following reason. In fibroadenoma and papilloma, there is a tumor mass which goes through hyalinization, and later on, I see the calcifications. In cancer, the calcification comes first, and then after that, the tumor mass. Not fibroadenoma, not papilloma. What's left? Fibrocystic change or cancer. And then I decided that, I don't want to have cancer for this woman. And I thought that this could be a teacup. I thought that this could be a weather light. Yeah, sure. Good thought. Prove it. I would not blast it with the core, because then if it's a bunch of cysts, then I'm going to really make it explode. So I found them here, at the bottom of tiny cysts. These are the calcifications. And I was gliding in a venipuncture needle, but I didn't know whether the stone is going to be bigger than the needle. So I took a chance. I took the fluid out and put it on a very thin, transparent paper, and we had a drop. And then we put this paper into the faxitron and magnified it. Thank you very much. Why don't you just go home? This is the end of your story. This is a weather light. It's not a cancer. 1 cluster. Beautiful, beautiful. 47. Dear colleagues, this is weather light. They are diffuse. The diffuse has to be casting one of the 4 casting families in order for me to think about cancer. But then you push and push the magnification, and you're going to get this one. And then you say, thank you very much. This is a surgical specimen, not because of this calcification. The other half of the breast had cancer. One more teaching point here is that it's hardly visible under the microscope. So it may happen with you that you do a core biopsy and you got the calcifications, but then the pathologist says, you didn't send me calcifications. Then would you mind reminding the pathologist, please use polarized light. Here is my calcification. Would you mind turning on the polarized light? Voila, here is the calcification. They are there, but the pathologists focus on cells. We don't see cells. This is the only thing we see. Spearhead, pyramid, scattered or focal. Do I see some calcifications here? You know, when you're magnifying, you find this, and that's a very focal bunch of tiny, tiny cysts within which there are the calcifications.